support the sport, the great game, and beyond. And this seems to be the year of injuries already. Spring training as it is, injuries are coming out of camp. And I always wondered how can athletes better position themselves to keep on going. And well, my guest has been answering that questions for years. Please welcome Tampa's own Dr. Tommy Rhee to the show. How's it going, sir?
It's going great, man. It's going great here. East Coast. I know you're out there on the West Coast, so
Yeah.
we got a little different weather, but kind of the same right now.
Hey, I used to live in Florida back in the day. My undergrad was St. Augustine. I went to Flagler College. I'm a Saint. Tampa ain't that far away. So
That's in St. Augustine, right?
yeah, St. Augustine right there on the East Coast. Yeah, First Coast is what they called it back then. So
That's the oldest city in America.
1560 something or other. I don't know. It felt that way because it closed at 6 o'clock. I'm like, what grandpas and grandmas be out here after 6 o'clock in the afternoon? So
Yeah, it's a good tourist town.
yeah. So talk to me, man. The path of medicine, was that always a dream, or that's something you fell into? What was the path and craft like?
Well, I think it's been set since my dad was a surgeon, working in Malaysia, and then being around that environment and seeing him take care of patients and understanding that that's probably something that he enjoyed, and I somehow adapted that enjoyment and just seeing how he takes care of people. It became like a simple kind of a marriage with the side of me that loves sports and being active, and then the other side that wants to help people, and then those two blended well together. So because of that, it allows me to stay in sports and act like I'm still a part of a team and become like an athlete or something like that. So it was kind of cool with that beside.
Yeah, I think so because your bio says you helped out so many. I say you played. You helped out with so many teams out there, Tampa Bay Buccaneers. But the one thing that stuck out to me as a big wrestling fan is that you're like in tune to that culture as well, right?
Yeah, but Tampa's big in WWE. I mean, it used to have the developmental camp here in Tampa, and so a lot of the big wrestlers, all the way from the old days before WWE, WWF, and all that stuff. It was like your names like Dusty Rhodes and all these wrestlers. It's Tampa. Tampa is the mecca when it comes to wrestling. So when you are coming back here at Tampa, you start seeing that kind of culture here, and then they get you involved with their group.
Yeah, it's just kind of a cool trip to go down to be able to do something you love and to impact so many people who are in some ways inspirational to the next generation. Like you're helping out athletes, kids watch those athletes, they feel they're superhuman. You get to help that story. That's pretty rad.
Yeah. I don't think it's a big deal, but people say, hey, I can't believe you're dealing with this athlete or this person. I don't know. When I look at it, it's just a anatomy piece of body, and there is an injury. My goal is to get them better. So it's kind of like not an odd situation, but I do see from another side of the view.
Yeah. So let's talk about this, man. The idea of regenerative medicine. That sounds like something that would be in a science fiction book. And maybe it kind of was a couple of years ago. The advances in medicine have been just astounding, right? The idea of making people ready to go back on the field again. What about that particular pursuit really drew you to specializing in that direction?
I was always involved with recovery and just getting back to 100% with athletes, right? It's all about working out and then understanding about the injury side of it. And then the other side was basically the recovery side. You've got to figure out a faster way to get them back on the field. So with that, you start evolving with these guys, learning about like regenerative medicine. Then how it started off with a thing called like prolotherapy, where they just inject sugar water in you. Then it's PRP, where they draw your own blood, put in a centrifuge and put the growth factor back in there, and it's supposed to heal that tissue from the growth factor of your own tissue. Then you get stem cell therapy. Stem cell therapy is the new wave, right? So that's the buzzword. Now everybody hears about stem cell therapy and all this kind of live cells. So as I'm working with these athletes, I'm applying that same principle to these athletes too, regenerative medicine and these kind of capacity of injectables. But the problem with is that stem cell therapy or regenerative medicine, it has its drawbacks. Number one, it's injectable. Injectable meaning that it has to go through your skin and into that damaged tissue. And then you have like the secondary injury site. So these athletes don't like this regenerative medicine during the season. You're not going to hear about this stuff like when they're playing, they have to, especially in baseball or basketball, that you have several games that week. I mean, the downtime of these injections are like weeks. And you take somebody out of a game, that's their career, that period of time, it plays toll on their playability, and more importantly, if they're if they're understanding about their contract and they're at the end of their contract, those things come up when they're negotiating their contract to re-sign. So they want to avoid those things. So that's why it's very imperative to understand about the injectables. And then the next step is that how do you do this delivery of this type of stem cell information into that tissue? And then once I understood the athlete and their wants and needs, I said, all right, there's got to be something. And that's how I moved into the topical side of it. And that's why I developed RheeGen.
Yeah, so I would love to talk to more about RheeGen in depth, but the idea of injectables having so much downtime, I had no idea. I had no idea that if once you get a stem cell injectable, you're pretty much on the shelf for an extended period of time. And they made it sound like it was something you just did like outside after going to Walmart or something. You know what I mean? Like that's wild. And so when that was really the soup du jour, what was like the internal battle? Really was like, did athletes really decide to say, I'm gonna hold off, play through the pain for weeks upon weeks and get that in the off season, or was it kind of like a non-starter for athletes in the midst of a season?
Okay, so think about like in NFL. NFL is a contact sport, and there it's a little different because the contract is not so much guaranteed. It's based on performance and bonuses, so they have to be on the field. So those guys don't want to miss. So instead of having that downtime, knowing that regenerative medicine stem cell therapy will get them back in a healing and pain reduction, they would rather mask the pain, deal with it later after the season, but be able to play, keep going. So that's the big thing about pain management. It's about really masking the problem that they have. And with that, you'll hear like, after a season, they'll do a surgery, right? Because it deteriorated so much that you can't do like a normal recovery. You have to do some type of like surgical procedure to get it back to normal. If it's an attachment, if it's a tear that needs to be repaired better, or if it's something else that's kind of like, shave it down because you create so much like they call it like exostosis or bone formation. You gotta shave that down. But it's all cause of just that pain and initial irregular joint motion that could be stopped if they just took a little time off or speeded up regenerative medicine. But then, of course, the downfall is that downtime from the injection.
Yeah. Well, here in the baseball world, you hear a lot about the UCL tears and sprains, and that sometimes there's a combination of ways to treat that depending on the athlete. And so I look at something that Shohei Ohtani did or Bartolo Colon did, going the stem cell research route. Has that even, from your estimation, I mean, what was that like? Is hearing that being used for that particular application?
Oh, it's fantastic. I mean, but here's a good thing about like if you understand about what he went through. So he was at the post procedure, right? So he was looking at it from like after the surgical, how to come back from the surgery center. Well, if you can address it before that injury starts coming out, because everybody's going to have a compromised tissue. It's going to happen, right? When you throw that much and at high velocity, you're going to compromise that tissue. That ligament, it's not a vascular tissue. It doesn't have that much blood flow. So it can't heal as fast as like a muscle tissue, right? Muscle has a lot of vessels and capillaries and blood flow. So it heals faster. When you look at ligament, it's a slow healing process. So you need something to speed it up. Now, if you look at it before the actual injury becomes a tear, it could be like a micro little irritation, right? You have to address it fast as possible. When you address it fast as possible, then you don't have that big damage, right? That big tear. So that's where regenerative medicine in that capacity, but non-aggressive regenerative medicine can avoid the surgery, or better yet, avoid that season-ending or career-ending procedure.
Yeah, it just seems like a generation ago, things like UCL and ACL tears or sprains were kind of like career enders instantaneously. And I feel like we've already advanced to the point where it's like, let's evaluate the severity to make sure we have a course of action, which already sounds fantastic from the medical standpoint.
Yeah. I mean, especially when you come to pitchers, I mean, you're talking about that high velocity. What you're trying to really do is think about what that mechanism is. You're trying to whip your arm, right? You're trying to dislocate every joint in your body and to get that ball going fast, right? So that's a tough thing. You just gotta make sure that every structure is capable of holding that. And the tough thing is it's like a catch-22, right? You have to practice. You have to work on the velocity. You have to work on that biomechanics. You have to work on all that. But at the same time, you need to rest. So you have to walk that fine line. And in the professional world, that fine line is kind of pushing it into the actual aggression and almost like into the world of overtraining, because you're adapting. You're moving into the perfect like biomechanics. But again, your tissue is not catching up.
Yeah.
Especially when you get older or you're prone to injuries, that's where the compromise comes. And that's where I feel that once you understand about regenerative medicine, you're going to see these pitchers advancing faster. These balls are going to go faster and faster because now they have the ability to actually recover faster to keep their techniques and practice going.
I'm at the age now where I can't even watch videos on TikTok. I go, oh man, look at those knees. You know, oh man, look at those elbows. You know, so all right. So we'll talk. We talked about this a minute ago, but I like the fact that your approach is a bit different. So with the RheeGen product line, you're looking more of a topical solution to regenerative medicine. Does that have the same like efficacy? Like, what was the idea behind that? Saying, look, we're going to make sure this is a possibility without using the needle.
Okay, so you have to go one step back and understand what stem cell therapy is all about. So
Okay.
people think stem cell are these, you know how this, like clinics will advertise 10 million live cells. That's how much injections that I got, right? Live cells, live cells. Well, if you understand what live cells are cells that have a nucleus, chromosome, genes, right? And it has this capability of doing something. Now, here's a tough thing. You have your own existing tissue with its own set of chromosomes and its code. How is that tissue that you're getting from, let's say, an umbilical cord, Wharton's jelly, match your tissue? It's not. It's impossible, right? So you have to take the next step, which is basically the signal. It's about the signal it secretes. The information in this form of like microRNA or protein, cytokines, enzymes, some information that tells your existing tissue to do its job. Because when you're injured or your age, your signal decreases. We don't have that bright signal when we're 80, like we're 15, 16, 17 years old. So
Oh,
it's about having that signal increase. And that signal increase is in the form of these little vesicles called extracellular vesicles. That information is what's important because it's cell free, meaning there's no nucleus. What's important about having no nucleus, like a cell free, you don't have tumor formation. You don't know what's going to happen in these tissues. It may change. Let's say that tissue is targeted to be a heart and you put it into your leg. You don't know what's going to turn into. That's why the science is not out there about that. But the science is out there about the signal. And that's why you're starting to see a wave of this information about cell free. Now, remember the words like exosomes, right? You hear
mhm.
these peptides. Well, those are signalers. They are signaling your existing tissue to do something. And that's what this is all about. So when you have that smaller molecule versus a live cell, smaller molecule, then you can put it into a topical cream with a transdermal agent. And then what that does is it pulls that through the skin into the deep layers and then targets some tendon, muscle, and joints.
I like the idea, man, but I bet you're are coming across those who say that seems very homeopathic. I'll just use mineral ice or something like that, which is different science altogether. But what do you say in that position when it's like, no, this is actually backed by science. This is different than going to Walgreens and getting Bengay or something.
Yeah, I mean it's a freaking question. The thing is that you just have to understand that people are going to ask questions. So in my world, it's a blessing and a curse. Blessing me, I'm the first one out there. You know, when I developed this, no one was on the market. Nobody understood about topical application of this type of signals, right? They all kind of knew about the process, but they didn't really know what stem cell mechanism was. They just knew that you get stem cells and it does this. If you ask other doctors, they don't really know what goes on. They just say it differentiates, it turns into this, but they don't know. But they have to really like analyze it further and say, all right, maybe that's not what it does. Maybe it's about the signal. And that's where you see this trend coming into the signal where I was at. So now with that, you have to educate. So the curse is that I have to educate people. So I'm the
Mhm.
first on the market, but I also have to educate people. And there are people out there that are doing similar things that I am, which I don't blame. I do the same thing as far as developing a product like mine. But the information is very important to understand what's going on. So when they get the information and they have a comprehension of this whole regenerative medicine and the theory and the principle behind it, now you understand, okay, I need that signal. It's not about like having like a topical pain cream to kind of mask the pain, right? You want to mask the pain. All that does is basically like if you have a sprained ankle and I punch you in the eye, you're gonna forget your ankle. You're gonna think about your eye. Go, hey man, why'd you doubt me, right? Then
Yeah,
all of a
what
sudden,
the heck? Yeah,
yeah.
yeah, yeah.
And then now that's pain. That's pain management. That's what you're trying to do. But if you go to the source and heal the tissue, well, you know, the consequence, of course, is pain reduction. So that's what this is all about, going to the source and solving the issue.
So for the application of it, is it are you gearing it more toward is it more for someone of a certain athletic level, or can I just walk in there and be like, hey man, I did a 30-mile-per-hour underhand in a softball pitch. My elbow hurts. Can I get some of that too? Or what's the line in there?
Well, see, here's a great thing. This is geared, first, my first love are athletes and sports, right? So that's where I started off with. But the beautiful thing is that if those caliber athletes and how they aggressively go through their workouts and games and stuff that can handle that and recover fast, well, think about what an everyday person, that goes through their little weekend or their event. Well, not as too, no, not traumatizing, but they still have pain. So if it works for an athlete, it's definitely going to work for the civilian world. So I see this in every aspect of course, sports and stuff like that. But more importantly, when you look at like everyday people that have like arthritis, some joint repetitive injury, well, that's the thing that we like to see. Because when you get to a certain age and you get the repetitive injury, that chronic injury, like on your elbow or your knee, it just doesn't will heal. Well, because the signal is not strong enough. You've got to get a stronger signal. And that's what this is all about, increasing the level of signal to that damaged area. Because once you get that existing tissue to get the right information, it does its job.
Kind of a general question here, whether or not we're talking about athletes or lay people. Do we not rest enough? Is that also the biggest contributing factor? You said overstress, overuse. Are we just doing too many errands? Are there too many baseball games in the season? Is that contributing as well?
Yeah, that's what it is. That's why you're starting to see like, little different rules with like, it starts all the way from a little league with the baseball pitchers, right? So many pitches you can do. So absolutely, rest. That's a big thing, is that athletes do recognize that there is the amount of force that you're applying during a practice, game, event. But then there's got to be as much recovery for that event, right? So when you start decreasing that recovery, let's say you do, what you're trying to do is basically, you work out, you break down the tissue and you rebuild it 1-to-1 ratio, right? But you build a better, stronger, faster muscle tissue, tendon, ligament, right? Now, when you start breaking it down, let's say you break it down 20%. Now your muscle is at 80%, but you're waiting for that recovery to get you back to 100%. Well, let's say you just go 10% recovery and then you start again. Now your benchmark is not 100, it's 90%. Now you're just decreasing. That's what they call overtraining. When you start breaking down tissue, your performance decreases. And then when your performance decrease, now you're questioning your technique. Now you're changing things around. Now you're questioning, hey, is it my coach? It can't be me, right? I'm too perfect. Am I doing this wrong? And then psychologically, it starts pulling them down. So it's a cascade that once they get in it, it's hard to get out of it.
Yeah.
So recovery is very important.
When we talk about topical regenerative medicine, like the RheeGen system, is it something like that you're doing to work through an acute pain episode, or is it part of a chronic regimen to have in rotation for ongoing health?
Okay, so if we're looking at the athlete, you want to look at the athlete, it's a prehab. It's one of those things that you get, let's say you get that UCL, that elbow pain, right? The typical pitcher thing, right? You apply that on there because you're going to beat it up and it prevents it from like slowing its progress of regeneration or recovery. So you do that for a pre. Now you can do for acute just to get that recovery faster, and post-op or post-workout or post-injury. Absolutely. So it's all the phases you can think of: pre, acute situation, chronic, long-term, repetitive injury. It's everything. Anything that has to do with regenerating or growing that tissue back to normal.
By the way, I gotta say, naming it after yourself and it being a pun, RheeGen, that's pretty clever, man. You know what I mean? You don't need a bunch of board members in New York tell you that. That's dope.
Hey man, thank you very much. It took me like I say, I don't know, I kept on saying RheeGen with the REGEN, like typically how you see it, right?
Yeah.
Then all of a sudden it was through a couple people suggesting, and it didn't click until I looked at it and goes, wait a minute, wait, what's going on here? And it just,
Yeah.
you know how it goes, right? It takes a village to take care of things.
Hey, man, it's all about the branding, man. So let me ask you this, man. When the day is over, when the stethoscope is down, what do you do for fun, man? How do you recharge? And I mean that like from a spiritual place, not like with
I know. So just like we said, spiritually speaking, I what's really important to me is, I'm a religious person, right? So
Mhm.
God's a big thing for me. And then I have to set my pace in the morning with meditation, God, make sure that's set in stone, and then something positive. If it's a video, if it's something that sets my tone, I want that to be heard first thing in the morning. You sure don't want to hear something negative first thing in the morning, and then the whole day is set that way. It's scientifically proven about that. So once I get to a point where the stress is pretty hard, I try to just shut my door in the office. There's patients. I still see patients. Shut it down, and I just get a 5, maybe a couple minutes of just meditating. Just really shut everything off and try to tune into one thing, and that is breathing. It really just tune into that, and then it like helps me reset. It just helps me reset. Then I can go back out there and tackle all the world's stressors.
Yeah. How do you deal with the I guess they call it now the imposter syndrome? I mean, you're in medicine. People say, "Oh, we're a thought opinion. You don't know what you're talking about." Like that must assail you at some point in your career. Like, how do you like block the haters out?
I don't know. I get a lot of haters, and I enjoy it. It's if you get, I mean, if you get haters out there, you're doing something right. I'll be honest with you. It's from
Yeah.
a compliment. So I
Yeah.
look at everything positive. You can do anything negative to me. I'm gonna say, hey, I really appreciate that. That tells me either I'm on the right path, or if nobody says anything to me, goes, oh, wait a minute, I'm not getting that kind of like that buzz or that questioning, and I don't know if it's envious, but I enjoy that. It helps me along. And I think because my personality is that I'm always optimistic. It doesn't matter what you do to me. I'm like, oh, okay. I broke my
Yeah.
leg. At least I get a rest time now. I'm out for a walk.
See, I would definitely say, "Oh, my leg is broken," but that's just me personally. So, do you can you enjoy sporting events, or are you looking at like how the body is moving the entire time? Are you like so locked into science, or are you kind of like, whatever, go team?
I'm gonna be honest with you right here. So sporting events nowadays, it's hard for me to watch anymore because I've been around it so much. On the sideline here, courtside. I've been around. Even in the Olympic world, I've been seeing it. The backstage more. I'm kind of burnt out because when I get in front of the television or I'm watching an event, I turn into the fanatic fan. I'm screaming, I'm yelling, I'm thinking I'm back there, I'm back in there, and I'm actually like participating in the sport, like cheering them on, and they can hear me, and they're kind of like taking my energy, and I catch myself yelling and screaming. Go, wait a minute, I need to slow down here. This is getting carried away. So
Yeah.
I tried my best not to watch sports for that reason.
I like the fact that you're also fanatic. You don't care about haters. So you must be a totally insufferable in the stand. I'm kidding. I'm totally kidding.
No.
That guy's good. Yeah.
I'm a gentle Ben, man. You can say anything to me. I say, I might toss a couple here and there, but I'm like, hey, we're all friends at the end.
I got you. So we're a baseball podcast, but in general, who was your team or teams? Or you're a local guy? Did you have like global squads you followed worldwide?
I mean, I like as far as professional teams. Of
Yeah.
course, I'm a Tampa Bay guy, so the Buccaneers, the
O-
Rays. When
Okay.
you go outside, I like underdog teams. I like teams that you don't have a chance to win because that's who I want to win. I
You get those
love
in
that
Tampa.
story.
You get those in Tampa for sure.
Hey, we had a good year here and there. We kept
Yeah.
me into the series.
Okay. All right. Hey, I'm not going to knock it. And so I always ask everyone on the show whether or not they think baseball is cool, but I'll ask you that if you can. But if not, whenever you go to a game, where do you sit? You sit up front. You sit in the back of the stands, like staying in the rafters. You get a hot dog. You're a beer guy. Like, what's the vibe you take to a game?
Okay, so with baseball, it all depends on who I'm with. I typically don't like to go by myself, so it depends on who I'm going with, right? If it's a first time experience, I try to get them on the third baseline, because you're gonna get a hit, you're gonna get pop up, you're gonna get something over there on the third baseline. And if it's someone that I just have a conversation, I try to stay behind home plate because you can have a great conversation there without interruption of the balls flying around you. And then
Oh, yeah.
I'm like, look, I like stadium food. It is so enjoyable. Everything tastes better at the stadium. I don't know what it is, but the smell, the pretzel, the hot, everything tastes good at the stadium.
Yeah, you can't knock that at all, man.
Okay, I'll tell you a story. So, when I used to be the doctor for the chiropractor, the chiropractor for the Buccaneers, right? So, I'm traveling with them, and once you get on the sideline, you start to smell. Everything's going on. You got the game, you got everything. So, I'm the kind of person that kind of gets bored a lot at the state in the sideline because there's not much going on. So I'm known to have food in my pocket. So in halftime, we'll go in the locker room and do typical stuff, work on people, and then I'll grab a hot dog and I'll stick it in my my hoodie and I slide it in there. And there's nothing better than having the actual sideline scene and you're having a little hot dog, couple of chips, enjoying yourself and watching the game. Like, I mean, it's right in front of you, just shooting by you. And like, that's how you watch a game here.
Heck yeah, man. I respect the heck out of that. out there smuggling some of the concessions. I like it. So as we wind this down here, man, I want to thank you so much about just being on the show, just and spending time about talking about the science. But about 12 months away from now, 18 months away from now, where do you see RheeGen? Where do you see the brand? Where do you see it being used if you had the magic wand?
12 months, 1 year from now, I see it as a global stamp in anything that has to do with pain. So we're going to see this in an OTC version of it, right to the consumer, inexpensive, much more cheaper, less than $100. And the neat thing about it, it has the same signaling and strength as stem cell therapy.
Wow, that's so great to get that over the counter. That makes it a lot easier, a lot more accessible for people. Doctor, thanks so much for the time. This is in the booth, man. I appreciate you.
Oh man, this is exciting, man. I love it, man. This is good.
Hey. All right. Don't leave me, doctor. Don't.